Good afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director of the Knox County Health Department. Our moment of gratitude today is for our child care providers. We are thankful for these organizations who diligently work to care for our children, the children in our community while their parents are at work. Many of them essential workers on the front lines of this pandemic. This week, we continue to distribute the cloth face masks that were sent to us by the state. Last week, we gave these masks to several thousand people in our community through curbside pickup and by distributing them to our partners who serve vulnerable populations. We will continue to distribute them in this manner as supplies last. This week, we will be offering testing to the public Monday, Wednesday, and Friday in a drive-through format. In order to reduce wait times, we ask people to call the information line prior to testing at 215-5555. You'll be given a window of time at which to arrive for your test. Testing for the general public won't be scheduled on Tuesday and Thursday, as we will be doing more targeted testing on these days, focusing on high-risk groups, areas where testing is not accessible, or testing things related to cases. Moving to our local situation. We have 295 confirmed cases of COVID in Knox County. Additionally, we have 2 probable cases. 226 of our cases have recovered. 37 individuals have been hospitalized at some time during their illness. Currently, we have 2 people hospitalized. Thankfully, we're able to report no more COVID-19 deaths at this time. You'll notice from the data that we experienced an increase in active cases. As we mentioned last week, we identified clusters and provided targeted testing for the new case from which new cases were identified. These clusters have resulted in an increase in our total number of cases. Through the work of our staff over the weekend, we've been able to, or are in the process of, contacting the people who may have been exposed as a result of these clusters. This is all part of our routine investigation. It's what we do anytime we have a cluster of any infectious disease, is identifying those folks who might have been exposed, educating them, and reducing risk. We will continue to update our case numbers daily at 11 a.m. on our website. As stated on our website, the benchmark data will be updated weekly on Friday. As we mentioned that we would do that last week. We continue to build out our website to include information about the benchmark metrics. That information was listed underneath the drop-down menu under each benchmark on Friday. So you click on that, you can see it. I'd now like to talk a little bit about what happened on Friday. The decision not to allow a reporter into the virtual media briefing was not made by myself or my staff. It was a decision made by the county's communications director that we had to honor. The way things played out on Friday was less than ideal. But I still stand by the volume of information we are providing to the community, the frequency in which we've made ourselves available, and the work of my staff. I think those in the media who have consistently worked with us over the years can attest to a commitment of availability and transparency. It has carried on through this pandemic and is why we've made ourselves available to our media partners daily for these media briefings. We've done one-on-one interviews with myself and my team, and the establishment of the Joint Information Center to help track and respond to your questions all day long. Some of these questions have been difficult, and sometimes they've pushed us to look at things differently. But we welcome even the most difficult questions and will always do our best to provide answers. However, because the response to the pandemic takes priority, some of these questions may not be able to be answered in the timeframe reporters might like. The team who is gathering and providing data on our website, in addition to weighing in on the media-specific questions about metrics and benchmarks, is also the same team who is on the front lines of our COVID-19 response, conducting case surveillance and investigations and performing contact tracing. I know people want to know more. That is a natural human behavior. More information, more data, more guidance. We understand that desire, and our team is diligently working to provide our community with everything we can. That's why we continue to provide more data on our website each week. We've tried to outline it in a way that caters to those who want to see the metrics, while also those who want a more straightforward rundown of how we're doing as a community, just the traffic lights. We've never claimed our webpage is a scientific document because it's not. Rather, it's a resource for our community. We want the data that we provide to be measured, meaningful, and provide value. We will continue to build out the information that's available to the public, but it's not going to happen overnight. Our allegiance, just like yours, is to our community. We know these are scary and uncertain times. We know that you want to provide the public with the information that is useful, and we want to help you do that. I stand by my staff, the information we've provided, and the timeline in which we provided it. And now I'll open it up for questions.
All right, as a reminder, please go ahead and submit your questions into the chat feature, and please write in the news outlet that you are with. From the first question is from WVLT. They asked, with more testing, Knox is seeing more active cases. What would you say to the public about doing their part?
It's a great question. And what I would say to the public about doing their part is that everybody has a role to play in whether or not we are able to open in a few weeks, whether or not we're able to open more in a few weeks, or whether or not we have to take a step back. Wearing your mask, staying home if you're sick, washing your hands, trying not to touch your face and nose, disinfecting and cleaning things. All of those things are things that people can do. And social distancing. How can I forget social distancing? All of those are all things that people can do that will determine whether or not we can open more in several weeks. So it's important. We expected to see an increase in cases. Actually, our increase in cases right now related to some clusters, maybe related to reopening. We're actually still interviewing those folks to learn more about how they might have contracted the illness.
From WBIR, with news from the Associated Press over the weekend that Tennessee is providing first responders, law enforcement, and paramedics with the names and addresses of people who have tested positive for COVID-19, is Knox County doing the same?
That actually is coming from the state. That was one of Governor Lee's executive orders that allowed for that to happen. And that is coming straight from the Department of Health at the state level. We are not involved in that notification.
Also from WBIR, do you think people knowing their information is being released after a positive test will discourage people from getting tested for fear of their information being released?
It certainly is a concern that we've had. And we voiced that concern to the state when they made this decision to release this information, as did several other health departments across the state and healthcare providers. But the Unified Command felt it was important to share with law enforcement, and so that's taking place.
From WBIR, after a surge of positive coronavirus cases in the Hispanic community last week, what efforts are the health department providing for outreach and help to citizens who are primarily Spanish speaking?
So we always have an interpreter at all of our testing sites. We use our interpreters over the weekend to help do interviews and contact tracing. We're working with our partners in the community who serve primarily Spanish-speaking folks so that we can reach out to that community and understand how we can best work with them to get folks who are at risk tested. We also we provide information in both Spanish and English.
Curious if you have any plans for neighborhood-specific testing on Tuesday and Thursday of this week. Last week, you mentioned that might be a possibility.
Thursday, we have a community event in Lonsdale, focusing primarily on the folks who live there, working with some service providers in that community, and we're looking at other possibilities as well.
From WBIR, do you have details yet on when and how KCHD and the National Guard will do mass testing at public housing developments in Knox County?
So it's my understanding that that will happen this weekend, Saturday and Sunday. Exact time is yet to be determined. I believe that'll probably be determined by the National Guard, probably in concert with us, but that's happening this weekend.
From the Sentinel, last Friday, you took a step forward and defined the mathematical undergirding for each of the traffic light categories used in your benchmarks on your website. It's safe to say that you're calculating those trend lines and statistics behind the scenes. Will you include them in the public-facing graphs?
We really haven't planned on including the calculations in the public-facing graphs. We'll include the data that's useful for our community to make decisions. We will be transparent about what made us change. Like if we go from red or green to yellow, we'll be transparent about what about the data made us make that change and how we came to that conclusion. So we'll be sharing that publicly, maybe not as part of the metrics. Exactly.
From WVLT, Knox is requiring people to wear face masks while in a gym. Is that safe to do? And how should you navigate wearing a mask and protecting yourself with your, I think that's supposed to say breathing while working out?
That's where we come down to personal judgment and decision making. Each individual has to decide what they can do and what they can't do with a mask on. But we were concerned about the fact that when you exercise, you're breathing out a whole lot more moisture and droplets than when you're not exercising. So folks will have to listen to their bodies and take breaks when needed, and just like they always do.
From the Tennessean, we are trying to assess healthcare system capacity here in Tennessee, especially with so many global healthcare companies and hospital chains based here. Can you let us know which hospitals and medical providers you are working in collaboration with and how you are defining what a surge might be or a second wave? So that information is on our website, but we work with all of our regional providers, and there are several of them, are the ones that provide services in Knox County and even some additional providers that are outside Knox County. So it's a regional hospital provider, sorry. It's all the hospital providers. They are looking at their surge capacity internally and working together and sharing that information. When you look at our website, you'll see the information on bed capacity, ICU, and ventilator capacity as well. That's the current capacity as it stands without surge. That will change when they need to surge. They're not there yet. They'll continue to look at that. We're in conversation with them at least weekly, if not daily. And it looks like, Mark, your question was also about the surge on the healthcare system. If that did not answer your question, please go ahead and submit it again so she can address it again. From WVLT, can you provide the list of questions that contact tracers ask people? Sure, that's on the Tennessee Department of Health website. So you can just go there and look for that and download it. From WATE, any update on the number of complaints, inspections, and or citations about not following guidelines? Since May 1st, the health department has received 69 food complaints and 42 non-food complaints. From the Sentinel, for someone without training in statistics, it is difficult to understand what a 14-day moving average compared to a 3-day mean looks like. It's also hard to understand what is meant when discussing standard deviations. Would you consider adding this to your benchmark presentation? You're right. That's why we have our presentation the way it is with the red lights and green lights. We gave you the background for that. And that's the background that our experts in epidemiology use to determine if we're going forward or we need to move back. And those are the numbers. And we have 39 years of collective epidemiology experience looking at these numbers every day and providing guidance for our staff, for our community. And our website is designed to provide information for the community and give them guidance on how we're doing, and really not designed to be a epidemiology 101. Any other questions? Please go ahead and submit them into the chat feature now. From the Tennessean, how is your department defining a surge? Is it 1,000 hospitalizations or some other general number that we can explain to our readers? We don't want to scare people, but we need to understand what the definition of a surge is. So it's really a rolling mean, and it really is also determined by hospitals' ability to increase their capacity. If you look, there is information, and we can get this to you publicly, about how they can expand the number of beds they need, and it's based on hospitalizations and based on their ability, what they know they can do within their facilities to increase bed capacity. So it's not based on any one number. It's not based on any definite percentage. It's based on collectively what's the capacity of our entire hospital system, to absorb more patients or not. From WVLT, with KCHD on the front lines, has any staff tested positive? We haven't had any staff test positive. From the Sentinel, you said Nashville had a lot more data to define its metrics. Are you defining a lot more by volume of metrics?
Actually, no, I'm defining a lot more by the number of cases they have, the number of deaths they have. Unfortunately, Nashville has a much larger outbreak than we do. And so they do have a lot more data because they have a lot more patients and cases.
I believe that answered your second question there. If it didn't, please go ahead and type it in again. The third question was from the Sentinel, if not a volume of metrics issue, why does Nashville have more data and what are you doing to get similar data?
Well, we don't want to get similar data because their data is a result of a higher number of cases. So we're happy with our low number of cases.
From the commercial appeal, in the answers provided to Knox County media last Friday, your epidemiologists have said that decisions to institute policy changes will not be decided based on a single metric in response to a question about what policies are being considered in the event of a second outbreak. We understand that multiple metrics must be taken into account, but the answer did not address policies. What policies are on the table during phased reopening?
Right. So if you look at our plan and actually read it, you'll see that we allow for mid-phase adjustments. And you've seen what policies have been put in place in the past. We've had safer at home, safe at home, curbside only, all of those different policies that have been put in place. So what we're hopeful for is that our metrics will indicate that we can move forward and not have to go back to those policies. We can move forward and do more opening policies as opposed to closing policies.
Any other questions? Please go ahead and submit them into the chat feature now. From the Sentinel, the Tennessee State Health Department released the hospital's reporting into the syndromic surveillance network and the prevalence for COVID-like illness over the course of the pandemic to the Sentinel following a public records request. Will you release the county level data?
Yeah, so I think we've answered that question in the past. We do look at COVID-like illness as a part of our information. And we've talked about before, one of our challenges is the way we pull that data out of the state's website or out of the website called Essence. It is not actually ADA compliant, so we can't post it on our website. Yeah, we're trying to. We're looking into how we can do that. So I'm not an expert on ADA and compliance, but we have folks in the county who are, and we certainly want all of our information to be ADA compliant.
From WVLT, we are over a week into phase one. How do you think it's going?
It's really kind of early. Again, I think it's going well. I think I still see people wearing masks. I'd like to see more people wearing masks, if I'm honest. But I think we've got over 700 businesses who've signed up for our listserv, and they're posting the signs and doing the things that we're asking them to do. So I think it's going well. If we look at the incubation period, for COVID-19, it's around 14 days or so. Most people getting sick around day 5 or 7, and then not really seeking care until later than that. So I think toward the end of this week, we'll have a better idea of what our cases are going to do. Like right now, our case count that's increased is mainly due to clusters. So I think we'll know more at the end of this week, definitely by the beginning of next week.
From the Tennessean, there was a report from Vanderbilt a couple weeks ago that anticipated 5,000 hospitalizations. We are not seeing that trend line now. Can you tell us how many hospitalizations you are anticipating in your region and what spike, they're asking for a specific number, that would cause you to think there is either a surge or a second wave when the additional bed space may be needed?
So there's no definite number that we're going to say that that's the number we're going to hit and we'll have to change things. It's based on hospital capacity and their ability to surge and activating their surge plan. Right now, they haven't activated their surge plan. Right now, they're this normal bed capacity. They're able to tolerate that. We've been very fortunate. Our hospitalizations, honestly, have been very low here in Knox County. We're hopeful that they'll continue to be low. We're not going to make any predictions on where we think that's going to go. We believe field epidemiology, really watching the true real-time data, gives us a better picture of what's happening in our community and what we need to do. So we'll continue to do that.
Any other questions? Please go ahead and submit them now. From the Sentinel, as a follow-up and clarification to my earlier question about providing more clarity on statistics, when I asked if you were going to make that available in the graphs, I was actually asking if you would add the trend line to the graphs.
Oh, thank you for that clarification. Sure, we can do that. Sorry.
As long as the website can do it.
As long as the website can do it. Yes, we can do that.
From WVLT, is Knox County short on any supplies?
I can only speak for our supplies, and we are not short on any supplies at the health department. I can't speak for hospitals or other providers with how their supplies are, but as far as I know, we haven't been told anybody's short on supplies right now.
Got time for just a few questions left. So if you have any additional questions, please go ahead and submit them into the chat feature now. All right, since it looks like there's no questions being submitted, we appreciate you all joining us today, and we hope you have a great rest of your day. We'll see you tomorrow at the same